everyone. My name is Erica Botner. I'm the program manager for seniors and for the SHARC program at CHSSN. I'll be the facilitator for today's session. Today we have Jean-Philippe from the CIUSSS West Central Montreal to talk about user rights and your right to complain about healthcare and health services. So Jean-Philippe joined the CIUSSS West Central Montreal in 2017 and was appointed commissioner in 2021. He had a rewarding career in his many roles as policy advisor and press relations officer for the Government of Canada and general manager at the Association of Municipal Engineers of Quebec. From 2011 to 17, he also served as an administrative judge in the employment insurance section of the Board of Referees and the Social Security Tribunal of Canada. In his current role as commissioner, he ensures that the office he leads can carry out its mission with multiple partners, be they public or private. He's been an accredited mediator on Quebec's Department of Justice roster and commissioner for oaths since 2020. And he's going to be here, he's going to be answering a couple of questions in this presentation, including what if you had a say in the way that you receive your healthcare and social services? And what if you were able to provide feedback to your care to improve them for the benefit of all healthcare users. So what I'm going to do is hand it over to Jean-Philippe.
So thank you very much. My name is Jean-Philippe. I'm the commissioner for the CIUSSS for West Central Montreal. So for the ones who are not in the Montreal area and is not aware of how the healthcare system is partitioned on the island. You have 8 commissioners on the island. 5 are territorial and 3 are CHU, CHUM, MUHC, and the Pinel Institute. West Central Montreal is mainly the Jewish General Hospital and surroundings, including Côte-Saint-Luc, including Montreal West, including City of Mount Royal, Outremont, Westmount, and a couple of parts of the plateau in Montreal. So we're dead in the center. So that's the CIUSSS for West Central. Primarily, the CIUSSS for West Central is the Jewish General Hospital, which is called the chef-lieu and administrative building of the CIUSSS for West Central Montreal. The PowerPoint I'm presenting is a derivative of a PowerPoint I'm presenting to our users committees, to our higher and middle management, including employees across the CIUSSS. I'm not a lawyer. This is not a law class, but when we talk about rights, when we talk about a complaint system, when we talk about complaint rights, it comes with certain, I would say, legal obligations. So, as I said, it's a derivative of, I'll show you what we do, who we are, or the names of the people who work with me, and how it works. So, a general understanding of what the complaint system is and what the complaint rights are when you feel that your rights are not being upheld. So, plan for today, who we are as the Office of the Commissioner, and who are the medical examiners appointed by the Board of Directors of the CIUSSS for West Central. Every single CISS or CIUSSS or healthcare organization across the province has a commissioner and at least one medical examiner appointed by the Board of Directors. What are general definitions of which we work with on a daily basis? Presentation of the Commissioner's Office. We are 9 people to cover 180 sites of healthcare and health services provided, given that a résidence intermédiaire, a résidence pour personnes âgées, long-term care, hospital is a care site. It's about 180 institutions that we cover, covering from the biggest long-term care, which is Maimonides in Côte-Saint-Luc, to a small RTF, which has 2 people. We cover everything, every kind of mission outside of Direction de Protection des Droits de la Jeunesse, so youth services. We don't cover youth services. That's the West Island. But I cover, for example, 811 for the whole island of Montreal. and it's the biggest 811 service, Info Santé, Info Social, across the province. So one commissioner, two assistant commissioners, 4 advisors, and three staff. And everything is pretty much representative of what's done in the rest of the province. This is not a me-only thing. We have mostly that much employee to do as much as we do. So our main role is the examination and processing of complaints, the assistance to users in the complaint process. You call us, you say, I have an issue. I want to speak with someone about that issue. I want to see if that issue sticks. I want to see, am I the only one in that situation? I want to talk with someone about that. We're usually the only phone number for an extension that answers. So when you call across a hospital or you call across a CLSC, the purest chance that you might fall on someone that day that answers the phone is slight to none. You have a better chance with our departments. Within 12 to 24 hours, you have a callback. So that's mostly what we do in complex departments. It's quality of service for me. So our general objectives doing that is enshrined in the APRI, is to ensure the respect of users' rights and improve the quality of care and service. The title of me is Service Quality and Complaints Commissioner. Service quality comes first, Complaints Commissioner comes second, meaning that with the complaints individually and a macro level, our role is to improve the quality of service and to speak the voice of the people within a system that's more and more closed up to the voice and less permeable to the voice of patients across the province. Presentation of the medical examiners appointed by the board of directors of the CIUSSS, 10 medical examiners that cover about 250 files a year. So you'll tell me a doctor that actually looks at a complaint against a doctor. The answer is yes. That's how the system works. I would have chosen otherwise, but the legislator has decided even to carry over that very old system into the new APRI. So it's a CUP overlooking what a CUP is doing. That's what the medical examiner process is. And I can't say that it doesn't work. It works most of the time. I'd say 50% plus 1. It works most of the time. The role of the medical examiner is the examination and processing of medical complaints. The general objectives are the same as mine: ensure the respect of users' rights and improve the medical care and medical services that are provided by physicians, dentists, and pharmacists that work within our healthcare system, whether private or public sector, because we also cover a bit of the private sector in healthcare. As I said, I'm not a lawyer. This is not a law class, but we have to rely on something to assume a definition of something. So first question I have for you is, who can file a complaint? Is it anyone? Is it everyone? Is it only you as a person who received the services? Who is it? And there's a very narrow definition of who can file a complaint. That definition is the person who receives the care. That's it. At the moment that you're 14 years and older, you're the only person who is allowed to file a complaint. So at the moment that your children and grandchildren attain the age of 14, they're on their own. They can file complaints, they can ask for their own medical files, they can go to the doctors and physicians and see the nurses on their own automatically. Same goes with the healthcare complaint. Who can file a medical complaint? That's getting broader, and that's where usually we all get messed up. Because who can file a complaint against a doctor? The real answer is yes, a user, as defined, as I just defined, but everybody else. When I say everybody, it's everybody else. Doctors against doctors, staff against doctors, members of the public against doctors. You have not to have received any services from that doctor to file complaints against him or her. It doesn't matter. So that is a very important distinction between filing a complaint in a non-medical context, in a medical context. Now, if for some reason someone is not competent and cannot act on their own rights, who can replace them? Who can be their representative in that, in the complaint system, but also all across the health? That's a list of people who can. So the curator, tutor, spouse, or close representative, relative, they say, of a user of full age under legal incapacity. Legal incapacity. The person authorized by protective mandates, or that's the broadest of the broad, a person providing that he has a special interest in the user of full age under legal incapacity. This means, and I have the best example because it happened once in my first year of work. I've been working in the complaints department at the Jewish General Hospital now for 6 years and a half. So I've seen pretty much everything. A lady was riding a Bixie bike, hit by a car, brought to the emergency, no papers or whatever. Who can actually choose what type of service she can receive, or if the service is good or not, or can criticize the service that she receives? It can be the paramedic, can be the person who was there when she was picked up by the paramedics, by the doctors. It can be a nurse. It can be a doctor himself, herself, that says, I see something that does not feel right with that person. I saw a colleague do something that I feel is reprehensive. I want to say it to someone, and I want to say it in all confidence. I want to say it in all confidentiality, which we do. It's never anonymous. It's confidential. We keep our systems to ourselves. We keep your names to ourselves. The systems are not CIUSSS systems, but ministry systems, and even the systems I use are. If someone asks me for the name of the patient, I say, which patient? Which claimant? They have never heard of that claimant. So we actually, I sometimes deny or refuse to answer questions. Has that person filed a complaint yet? I can't deny, nor will I accept to provide you any names because I'm not under any obligation to do so. Okay. So that's with me, but that's all across the province. Also, if your loved one has passed and you feel that there's something fishy in the way that they were cared for in the last days or months of their lives by the healthcare sector, you feel that you need to have more information to have closure. You can actually file a complaint and receive information that you wouldn't receive otherwise if you demonstrate that you're a heir or a legal representative of the deceased and you have to show documentation to do it. But it is a real possibility. It is something that we do. I would say weekly. There's someone who says, my dad died X floor of the Jewish General Hospital. I feel that my mom and I were not told everything. We were closed off from some information. Truthfully, if the deceased didn't want any information provided to their loved ones before their passing, there will not be information shared. But if they want to file a complaint against a doctor who was not thorough enough, was not forthcoming enough, same with nurses, you have a choice. Call the ombudsman's office, call the complaints commissioner's office, and there's always a space for you to be heard. That's one of the messages I want to come that needs to come across today is there's always a space to be heard. Okay, we'll find a legal way to hear you anyway. We'll find a way. We will not say no. We're not the no department. We're the yes department. Yes, we want to hear about you. Yes, we want to hear about the issues you are living with the system, because the system is known to be broken. And we're the living proof of that broken system. We wouldn't exist otherwise. All comments, complaints, and assistances to the Office of the Commissioner, we call them in general insatisfactions, because a complaint has a special definition. Assisting someone has a special definition. Intervening or intervention has a special definition in the Health Act that I have to abide by. So I have legal obligations. What is a complaint? How can it be filed? It's a verbal or written complaint. You don't have to write anything. You just have to call up, give your complaint by phone to someone or on a voicemail, and you have a complaint. That's as simple as that. Okay? And what can you complain about? What can you complain about? It's about healthcare service or social service that you have to have received, or required, meaning past, present, future. Okay, the service that you ask for might not exist yet, and you might be able to complain because you don't have that service in your area. Okay, so that needs to be clear. And it's against, so a complaint is, I don't want to say against, but I don't know how to say it otherwise. You can complain against healthcare services from your local hospital, so from your local long-term care, CHSSN, in your RPA, about any service provider that CIUSSS or CS or healthcare organization has a contract with. At those famous or infamous agencies that we're covering that now have been cut off by the ministry, but those agencies could have been complained over, and we received multiple complaints about those agencies providing services or lack of services or lack of follow-up by those agencies with seniors across the province. That has been forever an issue. They're trying to solve it, they're creating more issues. Look, when you're trying to solve something, you create more issues, more acute issues, or more refined issues. But that's how our system works in a very complex society. So a complaint has a definition. Okay, what does it aims to? Okay, did you digitalize interactions between users? Because in settings where you don't have an ombudsman office or a complaint office, you have a plethora of lawyers that are profiting from actions against hospitals and actions against doctors. That is seen in the US, that it's seen partly in Europe, and where there's no ombudsman and no complaint office, you need to get someone involved to try to have you chase after your own rights. We do it for you. Improving the quality of service, and it's not a punitive process. If you say, that nurse was mean to me, I want her fired, my first reaction of my employee's reaction should be, it's not possible, I'm not the employer. Okay, but I will refer the case to HR if needed. So that's one thing I can do. Management, meaning whom? Meaning in my CS, higher management. The directors and CEO and assistant CEO are responsible and in charge of coordinating an answer, meaning they're aware of every single complaint that comes across my desk. And through the complaint examination regime system, the Office of the Commissioner can make recommendations to the departments and the board of directors. Everybody knows that recommendations are not compulsory to apply, meaning that if I don't have a good understanding of how the system works, I can make a recommendation that will not apply, that is not good enough, and that will not change anything in the end. So a recommendation, the system or the administration can say yes or no to the recommendation. We have quite a high score. I think we're over and above 90% in our department. And sometimes you make a recommendation because the issue is so problematic that you really want to change and you want to instill change. But you know it will be rejected because it's too much of a change for them, but you want to challenge them to the end with that issue. That is also something that we have to do. So every single commissioner across the province does it. They do the recommendations, have a system change, but they also push the envelope 1 meter at a time. I would say 1 kilometer at a time, I wish, but sometimes we have limitations in the way that we do things. So are we cops? Are we cops? No. Are we judges? No. Can we impose a recommendation or a change? No. Negotiated change. We're more diplomats than we're judges. Okay, that's one thing to be understood. A medical complaint, the role of my department in a medical complaint is simple, is to hand out the complaint to a doctor in charge of that complaint. That's pretty much it. That's pretty much it. And they're in charge of doing the same thing that I do in my files. But doctors with doctors and non-doctors with non-doctors. We also provide help and assistance. Help and assistance, you call us and you say, I want to file a complaint. I don't know how to do that. I have questions about, will there be any kind of retaliation against me if I file a complaint? What are my rights? You call my department. We'll answer you. We'll provide you with the most information we can. If we're not the ones responsible for the complaint process, because Montreal is a Swiss cheese. More than Laval, more than Outaouais, more than Abitibi-Témiscamingue. We're a Swiss cheese, meaning that on my territory, I have 5 other institutions that cover certain parts of services, Sainte-Justine, the MUHC, St. Mary's Hospital, that's linked to the West Island, CIUSSS, another institution that is covered by Centre-Ouest. So there's a need for someone to understand the territory, to understand the services provided. And when someone calls our department, and we're one of the few complaints departments across the province that has English services. So we're the ones who receive the most calls on the island of Montreal for Montreal services, coming from the Anglophone community. So we're dispatching complaints sometimes to our colleagues across the island because we're the ones who are the most known. And if you type complaints and CIUSSS on Google, 3 in 4 chances that you end up on my webpage. 3 out of 4 pages. So we help you and assist you to seek the right service at the right time. Okay, timing-wise, that's pretty much what we do. You can receive technically 2 types of assistance when you call a department, complaints department. An assistance to file a complaint. So I want to file a complaint, call me back. Fine. What's the complaint? What's your name? How can we find you in our systems or in the CIUSSS systems? What is your address? What is the issue? What's the objective you have when you file a complaint? You want a resolution, but what kind of resolution is this? That's an assistance to file a complaint. There's also another type of assistance. That's an assistance to receive a service. Let's think of something very that does not exist. Okay, for someone who's called in a hospital, any hospital across the province, and has tried to get a grip of their doctor. Let's just push ourselves into the future and say, you need to speak with a doctor, your doctor, in X clinic at your local hospital. You call 1 time. You call a 2nd time. You call a 3rd time. A week becomes a month, becomes a whole spring, a whole summer. And there you say, wait, there's something wrong here. Nobody's answering the phone. Is it the doctor? What's the issue? I just want to have a discussion with my doctor. I just want to have an appointment. I want someone to call me back. That's as simple as by. You can actually call our department and we'll provide you with a service of, we'll send your message to the department saying, red flag, you have not answered anybody for I don't know how many weeks, call back that person now. And I'm telling you, our organizations do not like that type of service. For one reason, it's not a hard complaint, okay? But me, I like it because it might not be a complaint because it's not an annoyance enough for you to file a complaint, but it's annoying enough that you don't get the service that you're supposed to receive. And that for me is very important. As I said earlier, there's the micro issue or the issue, the individual issue, but there's also the macro issue. When in my department, for example, and it's not private information, it soon will be with the annual report being published on our website. 8.9% of every single action in my department pertains to external clinics of the Jewish General Hospital. Okay. And out of that 8.6, 70% regards 2 clinics. So meaning that 5-ish% of every single action in my department pertains to 2 clinics. It's not complaints, it's assistances. But clearly there's an issue there to be solved that the CIUSSS does not want to see or the hospital does not want to see. If I don't have the numbers to show, they'll tell me, Jean-Philippe, we receive 40,000 people a year in that department. 2 complaints a year, that department is not that bad. They're answering the phone within normal specs. Doctors are fair. Everything's cool and awesome. Is it really? Is it? I'm asking, is it real? So the more users, the more citizens come to our department with issues, benign or problematic or very deep issues, even benign issues, we want to solve because we want to have a system that works. Not a complaint system that works, a healthcare system that listens, that is proactive, and that is efficient, which everybody knows is not the case. Outside of directors and CEOs of CISSS and CIUSSS across the province who say they're all excellent, okay? You'll hear that in every single news outlet across the province. They're excellent. I tend to feel otherwise. So is the rest of the population generally. So there's a way to address that very, very, I would say, in all confidence in its complaint officers and complaint commissioners across the province. And assistance ensures that users and representatives have access to services, intercedes with departments to reduce the occurrence of non-medical complaints. We directly intercede with field managers to settle the assistance, and you have it. You have what you need within 24 to 72 hours, which is our pledge in the CIUSSS for West Central. I can't talk for my colleagues across the province, but an assistance is a direct intervention to solve an issue before it blows up. That's pretty much what's an issue, what assistance is, outside of helping you file a complaint. Intervention. Intervention is another term, or is another process that we use to solve issues. With a complaint, I need a complainant, which is you. In intervention, I don't need a complainant. I need to have a combination of hearsay, semi-proofs coming from staff, information strong enough for me to decide that a patient right or patient's rights are being disrespected. Then I open an intervention. That's what it is. I intervene from my own account. I intervene by myself on a certain issue to try to solve that issue with the organization before it blows up into complaints. So prevention, that's pretty much what it is. It should have been called a prevention intervention and not resolve a problem before it becomes complaints. It's discretionary. It can be opened following a report abuse or elder abuse, and the intervention report is for the board of directors. So the rendering of a conclusion post-examination is filed with the board of directors of the organization itself, whether it's here or across the province, it's the same. New thing since 2018 and reinforced since 2021, you can file with my department and with complaints departments across the province maltreatment reports or abuse reports. So in a report, my role is not to analyze the maltreatment report, but rather to react pretty much as a whistleblower line. So you send me something that is problematic, that is based in maltreatment, whatever you see it, you come across it, you are the receiving end of it, and I'll send it directly to the highest authorities in the CIUSSS for them to examine the situation, for them to come up with a solution, and for them to have them stop the maltreatment and abuse. That's what we're used for. In the complaint, we're the ones in that analyzing everything and coming up with a solution most of the times. In maltreatment or abuse, it's the opposite. We're a conduit and we're bringing the issues straight to the top. That's what we're used for. And in 2019, we had, I think, 2 or 3 files. Last year, we were at 348, and it's doubling. It's been doubling every year. And we don't know when that's going to stop. Because elder abuse is not new. It's not something that is new since that act has been in service. It's a very old thing, and that's something that is created and recreated in our society forever. Now it's just that we can actually, we've put a definition on it. We've put services on it. We know where to send it and who to trust with data. We're the ones to trust with data in regard to maltreatment reporting across the province. So under CHSSN, which is a research group, on my small territory that covers 356,000 people over 60 square kilometers, I should have about 3,000 reports a year. I'm at 350. So there's something that still needs to be said. There's still work and outreach to be done in communities to have those maltreatment issues being brought to our attention collectively. We're working for the collective good, not for our own sake. How do we come to a conclusion? Okay, so when someone files a complaint, what's the goal of that complaint? The goal is the improvement of quality of service, providing you as a person with an answer, and if that issue comes across too much, to provide the organization with a report that is timely and that has data to show where the issues are. Okay, but how we do it? We analyze your statement. We analyze the organization's statement. We look at the acts, laws, regulations. We look at the frameworks. We look at everything. Then we come up with either a solution or no solution, meaning that is there a gap between what was supposed to happen and what happened? If so, how we fill that gap, how we breach it, how we close it for you, and how we close it for future patients. That's what we do. So we do not render judgments. Okay? We're not judges. We perform examinations. It's not an inquiry, it's an examination, administrative examination. We render conclusions, not decisions. Those decisions not need to be applied as a judgment. We emit recommendations, which is a privilege of the commissioner in the Health Act. So, you may know that all insatisfactions are not complaints now. All complaints do not reach our office, because with the number of actions that every single healthcare provider does in a day, how come I get 3,500 files a year? And the hospital I work in the CIUSSS I work in, has 11,000 people. That works 365 days a week, 24 hours a day. So we receive a very small part of those insatisfactions. We work at our obsolescence, but it doesn't work, because the system is ever evolving, ever changing. The needs of our populations are ever evolving, ever changing, but we need to have a photo, a picture of what's happening on the ground, and managers rely on different sets of information to do so. They do rely on ministerial data, they do rely on whatever is brought back by staff, but also by what's been brought to the table by complaints commissioners across the province. We need your input to make the system better. That's simple as that. I keep on saying things that goes against the grain. That's my role. I go against the grain. I do and say things that are not universally liked by the authorities of the CIUSSS, whether the board, the CEO, the ministry. How can I do that and not be fired? I answer to the board of directors of the CIUSSS and not to their management. So is every commissioner across the province. We're diplomats in the way that we interact with the system. But we can be hard knocking too, because we have a voice, and we use your voice to have a voice. Okay, so I'm appointed by the board of directors of the CIUSSS for West Central Montreal, and they have entrusted in me their every last penny, I would say that, for me to bring them the issues that percolate within the system, but the rest of the health authority does not see. Okay, those issues are the issues coming from patients across the province. We have examination powers. That power is derived from a section which is called Section 36 of the Health Act. If I need to produce an employee before me, I do. If I need a document, any type of document, I can ask for it and it will be provided to me, as long as I know what to ask, because that's how it works. That's Section 36 right there. Recommendation power. I need to render a conclusion in a complaint within 45, not business days, but calendar days. And one of my powers is to make recommendations that will be looked over by the organization. So they need to look at what I produce. They cannot just put aside everything that I do. They need to look at it and they need to provide me with an answer. And if I feel that there is still an issue with the recommendation I did, with the issue that's been brought to me, and I feel that there's still a breach of rights, I can actually signal that to the minister himself, meaning that I have an email box in 2 weeks on, I can say, here's the issue, here's the recommendations, is what I provided to the board of directors. They said, no, I feel that there's still an issue with the patient's rights. Minister, please act. Thank you. And a fine. Okay, so the minister is put in the loop of certain macro issues or micro issues, might be the issue you brought to the table. The minister will be made aware of it. So what are the possible conclusions when you come to a commissioner's office? What can you expect? Okay, there's two official answers and one that is not quite official, but is a possibility. So the review did not identify a gap between the practice and best practice. That's what I said earlier. The review found a gap between the practice and the best practice. That's where you have a recommendation. And one unofficial, the review has identified a gap between a practice and a best practice, and the facility or the establishment has brought forward a commitment to make a change in the future. So self-awareness by the institution, they see that something has gone wrong and they want to right it. That's what it is. That's not official in the Health Act. In the Health Act, I should do everything by myself and not take anything from anything else, from anybody else. But reality is that self-realization in that system has a better chance of finding a way in departments if they find and they see their own problems. And that's where we want to go. So what do you need to file a complaint? It looks long, but is it? It isn't. Who, what, when, where, with whom, with what, about what, your private information, your RAMQ number, and what's the objective of your complaint. It's not a long list. It's simple as saying, it's me. This is what happened. It happened yesterday at 2 o'clock. It happened in my home. It was with an orderly coming from the CLSC. It was with a wrench. It was about a service I was receiving. Here's my address. Here's my RAMQ number. All I want is that person being as far away from me in the future as possible. There you have a complaint. Simple as that.
Yeah.
We want to solve everything, but if we try, we create more issues. We're trying to level out the issues that are in front of us, because not all issues that prevail in the healthcare system at the moment are created at the level of the organizations themselves. There's sometimes, most of the times, created by the ministry and created by policies enacted by provincial parliament. So we try to level out the issues. But it needs, healthcare system should be a healthy valley with mountains, not the Everest at every corner street.
Right. One of the first questions that came in was, is there a statute of limitations to file a complaint? So like,
yes, a limitation in time. That's what I said.
Yeah, exactly.
The answer is no, but we have to act with some common sense, meaning that if you're complaining about something that happened 5-6 years ago, and it's about something very specifically about one caretaker, one nurse, one doctor, they might not remember what happened, and you might be disappointed in the answer that you received. So the right answer is no, there's no limitations. But the reality being that if something happened, like 2 years ago, we had a file of someone looking for their buried fetus, born in 1980, unborn in 1980. She was looking for where that infant or where that fetus was buried. We could help her find which funeral home handled the situation. We could not access the file because 1980s file and previous were all paper and were partially destroyed. So there are limitations into what we can do.
How do you find the commissioner in other regions?
How do you find the right commissioner for you?
The right commissioner for you.
Montreal, just call one and ask him. But for the rest of the province, there's a list, and I can provide you the list after this meeting. Maybe Erica can can send it to you, but the ministry has a list and an explanation webpage of everything I just explained in a more politically correct manner with the list of commissioners across the province. The issue in the region of Montreal, on the island of Montreal in general, is that not every single institution, we have CIUSSS, so university hospitals, like the neuro, I saw something about the neuro, the Neuro Institute. The Neuro Institute is with the MUHC. So the MUHC commissioner is responsible for that. But it's a very, for the moment, it's a very localized system. It's meant to be West Central Commissioner for West Central institutions. I saw from Mrs. Poznansky asking, can someone from Laval file with someone from CIUSSS West Central? The answer is no. You're going to have to file with the Laval Commissioner. And they would have to look into your question locally to see if your question applies to policy, rules, and regulations in the area you're in.
That makes sense as well. And is your role, like Equality and Complaints Commissioner, different from an organization like CAP? Are you familiar with
it is
CAP?
different.
Yeah. So how is it different? Yeah.
Okay, we're parts of a continuum. Okay, we're pretty much the end of a continuum, but there are parts, there are moving parts before our continuum.
Okay.
If you have a fear that your complaint might not be understood, you want to discuss the situation with someone, you want to discuss the situation, but you don't want to discuss it with the person who will be in charge of managing the complaint. There are centres d'assistance et d'accompagnement aux plaintes. So every single region across the province has a CAP. And I'm at the Congrès de la Fédération des CAP just yesterday and today. So I know about their mandate. They are complementing what we do. They're taking you, they're asking you questions, they're putting your brain at work, and they are providing you with something that is finished. What's the issue? It's well written, it's well understood, it's written in a way that I will not understand maybe sometimes biases in the complaints. I will have something more neutral, more driven in my hands with a letter from CAP or an email from CAP. So it's true to say that CAP has a role. It has a role of assistance and accompanying you in the complaint process at my level and afterwards at other levels. They also have a mission of, if you live in an RPA and you have an issue with your lease, they're the ones to go to have help and understanding. If you feel that the conclusion that I'm rendering is quite not enough, you go back to CAP and you say, I want to file it with somebody else. Who is it? How do I do it? Can you accompany me again? So you're never alone in the complaint process. That's what the role of CAP is.
Can a complaint be made about a lack of English services?
Yes. The more we have, look, across the province, every single French Canadian Quebecers know there are Anglophones across our cities. Sometimes you blend well with the French speaking population. But I'll put this to you. If you're insecure, you feel threatened, or you feel that you need to say something, you want information, you're insecure, which language are you reverting to?
Your primary
I do the same.
language.
I lived in the US for a short while, in Ontario for a short while. Which language was I reverting to when I was angry, when I was appalled, when I did not understand anything, saying I should have that in French. I don't like the minute details. I can't understand the minute details. So even though my English is not half bad, but again, if nobody pushes for any English services, none, you will not receive any. You have a voice, use it. It might not work the first, it might not work the first time, the second, the third, the fourth, the fifth, the 100th time, but 101, you'll have enough your neighbors, your colleagues, your family, have enough raised a voice over the course of a couple of months, couple of years, that policy will change in your area and you will have access to English services. Whether it's one staff member who's an Anglophone in the CIUSSS or CIUSSS that would help you operate around the territory you are, to help you bridge with the services that you need. Never lower your voice. Has any Francophone ever lowered their voice in this country? No. You should either hear. You need those services. It's a right. It's a constitutional right that you receive healthcare services. Use that voice. Don't be in the shadows. Come to the light and ask. What's wrong in asking? And what's wrong in asking enough times that you get services in the end might not be for you here and now, but might be for somebody else in 15 years. How do we know?
And I think that the list of commissioners across the province is something that's going to be really helpful for us to distribute for the participants, for sure.
You have a right to choose the institution you want to receive services to some extent. Okay, CLSC, you don't have a choice. It's your local CLSC. Your family doctor is also regionalized. But when it comes to second line and third line services, you can choose the hospital you like. Whether it's Pierre Boucher, the Jewish General Hospital, Verdun Hospital, the MUHC, the requisition has to be sent to the hospital. And the hospital telling you, we don't want to serve you because you're not local, goes against the Health Act. Whether you like it or not, whether the hospitals like it or not, you can choose where you enter the hospital. They can tell you we have other priorities, but they can't tell you that you will not receive any service. So the first thing would be to call the commissioner of that hospital and have that commissioner look at the issue. And if you feel that the commissioner was not thorough enough and does not provide you with the right answer, being you can be served wherever you want, that's in the Health Act. My father, for example, the first time he had a renal issue, he was in Thetford Mines. Nobody in Thetford Mines said, we can't hospitalize you. We will send you back to Saint-Jean-sur-Richelieu. Doesn't make any sense. If you want to take your services out of the West Island because you feel that you would have better services out of the West Island than in Anna-Laberge, you have the right to do so. Okay, so if the commissioner does not come to that conclusion, then the protecteur du citoyen will come to that conclusion. So the provincial ombudsman will come to that conclusion.
Well, on that note, I think we'll close up. I want to thank everyone for being here this morning.
Thank you very much for the invitation.
So lucky to have you here, so knowledgeable, and I think everyone really appreciates, as Barbara said, your positive take no for an answer attitude. And hopefully if everyone here shares what they learned, then we'll be able to continue to spread awareness and continue to be able to help to improve the system as best as we can. So thanks, Megan, for the tech support. And on behalf of all of us, a huge thank you to you, Jean-Philippe. It was really a pleasure to have you here.
Thank you for the invite.
You're such a great resource for us.
And you're welcome. If anyone on the line here would like to have any type of information in regard to the complaint system, you're welcome to send an email or call my department. We have English speakers as frontline workers. So if you need anything, and we're not the right department, but we might help you transit from one department to another.
What's
We'll
the
help
email?
you.
What's the
We'll help
email?
you.
Okay, so thank you again, everybody. Take care, everyone.